In the last 1 year, in alignment with His Excellency, our dear Governor's vision for the health sector, we've actually done quite a lot across all the agencies of which we superintend in the Ministry of Health. We are aware that we are in charge of overseeing the activities of the Plateau Specialist Hospital, the Hospital Management Board, the Primary Healthcare Board, the Drug and Medical Commodity and Medical Agency. Of course, we also collaborate with the Plateau AIDS Control Agency, Plateau State Health Insurance Agency. So all of these different agencies have, in one way or the other, impacted positively in the lives of the Plateau people in terms of health activities. And for us as a ministry, there are quite a lot of activities too that we've also done in collaboration with both those that are our partners and even the Federal Ministry of Health through the sector-wide approach, the SWAP office, in alignment with all these activities, with the support of His Excellency. So many things has happened. In Plateau Specialist, for instance, we were able to launch and indeed commission the renovated administrative block that initially, it was built, but nothing was happening. He also ensured that the laboratory complex completed, equipped with commitment of over 2 billion naira for equipments alone. There was also the activity at the Hospital Management Board. We commissioned the oxygen plant at General Hospital in Pangshin and Shandam. This has helped a lot to ensure that our people were able to access oxygen delivery. Over this last 1 year too, in the primary health care, we were able to revitalize about 82 primary health care centers through the Impact Project, and His Excellency on his own was able to also revitalize about 15. This has moved some of the primary health centers from level 1 to level 2, meaning that most of them now have complete fence. They now have a complement of a security gate, light, water, and those things, that accommodation for staff. But recently again, to crown all of this, approval was given for recruitment of staff, and this have been done. The staff have been recruited, and now we're in the process of deployment. They have all been captured and indeed documented. So it's just for us to deploy them to all of these facilities that we have.
The World Health Project is not just a program. It is a promise to our people. A promise that no mother will be allowed to just die needlessly, and no child will be denied access to care, and we don't expect any community to be left behind. I'm therefore charging you to serve with compassion, work with diligence, discipline, report with accuracy, and guard against corruption. Together, we will build a healthier, stronger, and a more hopeful future for the health and the education system of our dear state. On this note, I want to also appreciate His Excellency, the Executive Governor of Plateau State, Barrister Khaled Manasseh Mutfwang. He provided the enabling environment. He gave us all the support and gave all the approvals that we sought from him to arrive at where we are today. And most importantly, accepting for Plateau State to be part of this Hope Health and Hope Edu project. On that note, once again, I want to congratulate all of you, and on behalf of His Excellency, the Executive Governor of Plateau State, and all of us gathered here today, to formally declare this orientation workshop open. To the glory of God the Father, God the Son, and God the Holy Spirit. Thank you, and God bless you all.
In the contributory health insurance scheme, the state were able to enroll not less than 100,000 people across the state. This is significant because from beginning we had less than 20,000. And so it's quite significant that now we are aiming to get to even 500,000. So we are hoping that going forward, we'll get more of this. The Ministry of Health, we've had to hold trainings for staff in various facilities. We've had to collaborate to ensure that programs that are supposed to be done, where the malaria program, HIV/AIDS, and all of those things, we're able to do all of that. And so we think that in the last 1 year, there has been significant progress in the health sector. One of the biggest challenge we have been facing in the health sector is the issue of financing. You know that resources are usually scarce. There are competing things in government. And so sometimes you want to do a lot, but the resources are not there. And so that has been our biggest challenge. But we want to thank His Excellency because despite all of that, there is still some support that has been coming. And our partners have been of great help in all of the things that we have been doing. Some of them have sponsored some of the programs that we are doing. And so we think that going forward, if budget is implemented as it should be, we think that a lot more can be done. But the biggest challenge facing the health sector is actually the issue of funding. One of the lessons I've learned in the last 1 year has been the issue of managing people and ensuring that things are done the way you think it should be done. Because of the way the health sector is set up, like I mentioned, there are several of these agencies that were supposed to work together. Sometimes it's a bit difficult convincing them on what you want to really do. And so I think that managing people has been one of the greatest challenges that we have faced. But otherwise, I think so far so good. We've been able to manage and cope the way it should be. So I think one of the biggest things that we have done last year was when we hosted the State Council on Health, where it has not happened in the last 12 years before then. And so when we came in, we felt it was good to set up a policy document that will guide us to manage the health system in Plateau State. And so to the glory of God, it was successfully hosted and it came out to be one of the best that was even acknowledged, at the National Council on Health. And so to us, it was a very good background for us to go forward. We've also, over the last 1 year, one of the biggest things that I can say we have actually achieved is aligning everybody under one budget, one roof, through the sector-wide approach. This has helped us to move together as a team in the health sector. And so it's two big things that I would say we recorded a lot of success last year. Well, you cannot score yourself. It's people that are seeing what you are doing. And I believe we've had some very positive feedback, particularly among our health workers. And that translated to some of the associations giving us recognitions in terms of awards, plaque of recognition and all that. And so it has given us the impetus to see that, yes, we are doing something. And for the citizens, not too long ago, we are also recognized, as one of those that the ministry has done quite well. And so we got some recognition from some organizations in the state. That, again, was an indication. And I can tell you that when you go to the grassroots, number one of the biggest thing that has happened through the Drug and Medical Commodity Management Agency is the cost of medications that has drastically reduced across all our facilities. Our procurement processes has also improved because now we are directly dealing with facilities to ensure that they get the drugs as at when due. And so that again is very significant. And you can see that even the traditional rulers, they were not too long, they were also decorated as ambassadors of primary health care. They were excited about it. It has impacted because they take responsibility, for what is going on in their various communities. So, and the feedback we get is that there is quite a lot of improvement in the health sector in the state. And so we're happy about it, but we are not relenting. We think that going forward this year, we'll do much, much more. As we move on to 2026, to move in alignment with His Excellency's vision, again for the health sector for this year. And he wants to refocus on the secondary health facilities. And so we are expecting that this year, by the grace of God, we'll have some renovations, some activity at the general hospitals and the cottage hospitals. Equipment will be provided. Similar for even the primary health care, which has been one of its major areas of focus. We expect that this year we'll be able to renovate and revitalize more facilities that will move from level 1 to level 2 and possibly even level 2 to level 3, so that the system will become more organized, referrals will become more organized, and of course, in alignment with the sector-wide approach, we intend that everything that we'll be doing, we'll do it in consonance with what the Federal Ministry of Health wants us to achieve. The Hope Project, this year we believe a lot of activity should be able to take place in terms of renovation, in terms of equipment supply, in terms of health workforce training, and even more and more recruitment that may also happen. The National Health Fellows Cohort 2.0 that will be starting very soon, we intend that as they are being deployed, using the experience of what happened during the Cohort 1.0, we think that we'll need to now sensitize the communities more on the need for them to actually allow these fellows to exhibit their talent, because most of them are talented. They want to impact. They want to do a lot for their communities. But without community participation, without community cooperation, they cannot achieve much. Just yesterday, they told us some of the challenges that they faced, those of them that were in cohort 1.0. And so to overcome that, the ministry, in collaboration with the office of the coordinator of the sector-wide approach, will ensure that at least going forward, we'll need to collaborate more with the local government chairmen, the community leaders, and those that are actually going to benefit from this, including our, the leaders in the health team, whether it is the in charges of primary health care, the medical superintendents of the general hospitals, or even the chief medical directors, as the case may be. So going forward, those are the things we'll be looking at for the National Health Fellows that will be coming on board soon. Long term, we are looking at a health system where the tertiary health center for the state will be a hub for medical tourism, where people will be willing to come to Jos, not only to come and relax, but to also access health care, where at the secondary care level, our people can get effective coverage in terms of personnel, in terms of equipment, in terms of the activity around it, that the environment will look very okay. Similar for the primary healthcare system, because that is the root of healthcare in our country. And so we intend that long term, our primary healthcare should be well staffed, they should be accommodated, they should have the equipments they need to work with, and to effectively train staff that will be able to recognize and refer where applicable. Because what we are facing is a situation where most of those working at primary health centers do not have the necessary training. So we are going to focus on all of that and ensure that whatever recruitment we are doing, it is the right people that will be able to be recruited and deployed accordingly. So long term, truly the health sector in Plateau, we expect that a lot of improvement will surely come. Well, one of the things that we always encourage our young people is to look at healthcare as sacrifice. It's an area where you don't expect that you will make a lot of gains. And so whatever you are doing, you must have the passion. And so for them to be effective in terms of healthcare delivery, the passion is number one. And of course, you look at the people that you are also serving. You should know that you are going to deal with all categories of people, because there is nobody that will say one way or the other he won't go to the hospital or to access healthcare. Either it can be your relation, yourself, or anybody. And so whatever you are doing, just ensure that you have that passion to deliver healthcare as it should be. And all the categories, whether you are a doctor, whether you are a nurse, a pharmacist, lab technician, lab scientist, whatever thing you are doing, just make sure that you follow the ethics of your profession. And we are going to ensure very strictly that people adhere to their specified jobs as it is described for you. So young people coming up, develop passion for healthcare, develop passion for people, and that way you will be able to impact on the health of. What we expect from the citizens of Plateau State or anybody living in Plateau is to have confidence in the health system, have confidence in the fact that all of us that are working in the healthcare delivery, we are committed to serve you. We are committed to ensuring that your health is properly protected. And as a Ministry of Health, we are calling on all citizens, let us first imbibe the principle of prevention, because they say prevention is the primary thing. Because when we prevent, a lot of things will not happen. We'll do our own part by enlightening the public, but again, we must learn to support what government is doing. We must learn to support what the people, what the policies that are on ground, and that way we can be able to succeed. And above all, let us continue to support the government. Let us continue to say positive things about what government is doing, so that the health system and indeed the entire activity in the state, will be achieved under the leadership of the governor.